University of Charleston women's soccer team here, and today I'm going to be talking about STD rates in West Virginia and options one can take to seek help or guidance. The top STD I will be discussing is chlamydia and effects it can have on both men and women. I will also be talking about HIV/AIDS and how it too can affect men and women. Once I discuss the two, I'll be giving a little statistical background on West Virginia and ways to prevent or seek help. First, let's discuss chlamydia in women. Chlamydia is a common STD for both males and females and can be infected by it. If a woman gets infected, it can damage her reproductive system. If that is damaged, then the process of getting pregnant can be very difficult. However, if a woman has chlamydia, gets pregnant, but does not get tested, then her newborn child can also be infected. Complications that can occur are inflammation of the cervix, urethra, and blinding of the uterus. Also, pelvic infection and pelvic pain can occur too. If a woman is pregnant and has chlamydia, complications that can arise are miscarriage, preterm labor, premature rupture of the membranes, and pregnancy outside of the uterus. Not only can chlamydia affect women, but it also can affect men too. Symptoms may not occur in men, but if they do, some are painful burning while urinating, unusual discharge from the penis, swollen or tender testicles, and fever. Another thing males can get is Reiter syndrome. Reiter syndrome is a medical condition that affects young men. It is characterized arthritis, conjunctivitis, and urethritis. If you get tested and find out you have contracted chlamydia, then some treatment may or can include antibiotics, even your partner needs to get antibiotics as well to be on the safe side, hospitalization if need be, and pain medication. To prevent getting infected by chlamydia, use condoms at all times, limit your number of sexual partners, and receive regular screenings. Chlamydia is very common in West Virginia. Chlamydia rates have fluctuated up and down through the past years. According to West Virginia's Department of Health and Human Resources, chlamydia increased in 2013, decreased in 2014, and spiked back up in 2015. At this rate, chlamydia will continue to be on the rise in West Virginia. The local e-paper in West Virginia called Herald Dispatch gathered information on STDs in West Virginia. Cabell County has the highest rate of newly diagnosed cases of chlamydia and third highest rate of people living with HIV in the state. Amy Saunders thinks this is because Marshall University and West Virginia University are all located in Cabell and Monongalia County. Continuing with Sanders, she brings to our attention that Kanawha County ranks number 3 for new chlamydia cases and is West Virginia's most populous county. Besides the STD chlamydia, there's cases of HIV lingering throughout West Virginia. HIV stands for Human Immune Deficiency Virus that weakens a person's immune system by destroying cells that fight diseases and infection. West Virginia is broken into 8 districts, and according to NAPAR from Health and Human Resources, West Virginia is one of the lowest states when it comes to HIV cases. In District 2 of West Virginia, there are 252 known people living with HIV/AIDS per 100,000. District 2 is made up of Cabell, Wayne, Lincoln, Mason, Logan, and Mingo counties. Number 1 for most HIV cases is within the gay male population and then along with the drug users population. According to AIDS VU, here are some more statistics on HIV in West Virginia. In 2014, there were 96 new diagnoses of HIV. Per 100,000, that means 6 people will be diagnosed. Death rate of HIV in 2013 is 31. The death rate per 100,000 is 2. In 2013, 25% of people living with HIV were Black, 4% were Hispanic, Latino, and 66% were white. 76% of people living with HIV were men, and 24% were women. If a person contracts HIV/AIDS, then they can get it in multiple ways, such as sexual intercourse, oral sex, sharing injection needles or works, or mother to child. To prevent contracting HIV/AIDS, one should get tested if you know your partner has HIV/AIDS, have less risky sex, use condoms, have a limited number of sexual partners, and do not inject drugs. Chlamydia and HIV can occur in multiple ways, but as long as you condone safe sex, you will have a healthy sex life. Thank you so much for listening to my speech.